So what we're going to do is we're going to look at some of the anatomy that's pertinent to level 1 lumbar spine. And we're just going to start with a typical lumbar vertebrae. So we're going to inspect a typical lumbar vertebrae, and you're going to see that it has a vertebral body, and that vertebral body has an hourglass shape to it. In addition to that, it has cortical bone on the outside and cancellous bone on the inside. So here's a picture of the typical lumbar vertebrae, the cortical bone on the outside here, and the cancellous bone on the inside, which of course is present for the bone marrow and the production of blood cells. Returning back to the vertebrae itself, there will be an end plate that we're going to talk a little bit more about on the top here. It's not as noticeable on this slide here, but we'll talk about the end plate in a little bit more detail when we talk about the lumbar disc. Next, we're going to look at the pedicles. Another structure we're going to look at is the inferior and superior articular processes. This is the inferior articular process, and that's the inferior facet. Now, as far as terminology is concerned, and we do not typically want to call them facet joints, but they're zygapophyseal joints. Facet joints can be any flat surface that articulates, and the proper name of these joints are the zygapophyseal joints. They're covered with articular hyaline cartilage. In this program here, it shows the articular hyaline cartilage that covers the superior facet that would be articulating with this facet. And we can get a better appreciation of how the superior articular facet of one lumbar vertebrae and the inferior of the other vertebrae actually articulate. The next region we're going to look at are called the pedicles. They're on either side of the vertebrae. They bridge between the arch and the body and transmit forces there, and in Latin it means little foot. When they do cross sections of the pedicles, they actually have cortical bone on the outside and cancellous bone on the inside, and it acts like a true bridge or force transference or transferer, where they transfer forces from the neural arch, or which has more muscular attachments, to the vertebral body itself. The next structure that we'll look at are called the lamina. The lamina are on the back side of the vertebrae, and that's Latin for leaf or plate. We're going to see that the ligamentum flavum, when we look at the ligamentum flavum later on, attaches between the lamina of the vertebrae. The neural arch, in combination with the vertebral body, protect the spinal cord, or this is L2. So L2 is where the spinal cord ends, and then it'll protect the nerve roots as and the sacral plexus as they go down towards the sacrum. There's mammillary processes on the back part, and the whole purpose of having the mammillary processes is that's where you're going to have multifidus muscles attach, or other muscle attachments. So here's one without the attachment, and you can see the pin here where the process is hiding under or laying under the multifidus. And of course you're going to have transverse processes coming out. The third lumbar vertebrae transverse process is going to be the longest. The fifth is where the iliolumbar ligament attaches, and the length of it varies, and we'll talk about that more in level 2 and the reasoning behind it. So you can see that there's transverse processes for muscle attachment all the way down through, and you can see, as I've added on quadratus lumborum, that there's slips of that go into the transverse process over at the fourth lumbar vertebrae. So it's interesting when you add quadratus lumborum in, you look at its relationship with the iliolumbar ligament and the transverse process. There's some really interesting anatomical facts that are coming to light in these areas. One is that we're starting to think that these are more proprioceptors than stabilizers. The iliolumbar ligament itself maintains a muscular contractile tissues sometimes into your early 30s. The quadratus lumborum and the thoracolumbar fascia have interesting characteristics that help us think that outside of stabilization, there's proprioceptive characteristics with them, in addition to that of the iliopsoas. So stay tuned for level 2. We'll talk to you more about those structures and their functional significance with stabilization. And last but not least, we can't forget the spinous process that is present and the importance of being able to palpate the spinous processes, noticing that the fifth lumbar spinous process is actually a little bit shorter and stubbier, and they get a little bit longer. Because of the anomalies, it's very difficult at times to tell if a lumbar vertebrae is quote-unquote rotated just by palpating the spinous process. But you're able to at least find some of the locations of where the key vertebrae are through palpation by some of their anatomical distinctions. We're just going to switch gears quickly and look at the intervertebral foramen. Here I've removed L5 and we're taking a look at L4. You can see the fourth lumbar spinal nerve, and there's the dorsal ramus coming off the back, and the ventral ramus coming off the front, and this is the fifth lumbar dorsal root ganglion. You also are going to see the obturator nerve coming down through here, and the fourth lumbar vertebrae coming down through here. So I'm going to add L5 back in, and you can see that it's pretty tight quarters. So if you have arthritis going on, if you have disc inflammation going on, if you have thickening through the articular facets, as you can see where they are right there, it's already a tight enough space with the nerve and some arteries and veins going through there. Adding any kind of extra space there definitely can cause some problems. If we quickly look at the venous structures of the lumbar vertebrae, you can see that it's highly vascularized. What we want to look at is we want to look at the fact that the vertebral body itself has a lot of venous drainage that's present. And if we add the posterior longitudinal ligament to the mix, you can see that with certain spinal movements, it may be able to alter the outflow of venous drainage from the vertebral body. And we'll talk a little bit more about this in level 2 and how this might change the pressure within the cancellous bone as arterial blood comes in and venous blood can't drain out. So stay tuned. Back at the ranch, I just want to show this is T12, the third lumbar vertebrae, and the fifth. So what we can do is we can take a look at the orientation of the facets. So if we inspect L5, you'll notice that the facets lie more in a coronal plane. Actually, this one has a little bit of a tropism, where you'll see this one is lined up differently than this one. They're J-shaped as well. That limits rotation, but also anterior and posterior translation. If we look back at the third lumbar vertebrae, you're going to see the fact that these are definitely more sagittally oriented facets, so definitely guide more flexion and extension and don't limit translation quite as much. That will be the job of the ligaments and the disc. And good old T12, if we inspect it, this is the one that's kind of fun because it definitely has different facets at the top and at the bottom. So you can see that these definitely are lined up more to accept the L1 sagittally, and these ones have a little bit more of a coronal input. So these transitional zones, L5S1 and T12L1, are going to be very important when we're looking at rehabilitating this area. We could go all day long, but what I'm going to do is talk a little bit more about some of the ligament structures before we finish up. This is the anterior longitudinal ligament. Now, what happens with the anterior longitudinal ligament is that it runs the entire length of the spine, and it forms the AO and the AA, the anterior ollando-occipital membrane, as it goes superiorly. It doesn't attach to the disc, but what we see here in red, these are actually the attachments of the diaphragm. And according to Bogduck, he thinks that the prolonged tendon is the attachment of the crura of the diaphragm, and that forms the anterior longitudinal ligament. That's where they think these fibers are forming from. The posterior longitudinal ligament, which you can see better through here, actually resists separation or posterior separation of the vertebral bodies with flexion. It attaches to the disc, but does not attach to every vertebrae. So it stays loose. So remember, we showed the basal vertebral arteries as they were coming out, and it's loose behind the basal vertebral arteries. This right here is the ligamentum flavum, and it was always hard for me to picture, so that's why we removed the vertebrae. So let's take this one away. So what you can see is you can see the ligamentum flavum, which is 80% elastin. So actually, when you bend forward, and 20% collagen. So when you bend forward, it actually will not deform as much as if it's collagen, or even backwards. So if it was pure collagen, it would tend to buckle into the spinal canal, which is not what we would want. So if we put it back in, you see that it would encroach upon the spinal cord, and that would not be good for business, would it? So here's the ligamentum flavum in its relationship to the spinal cord. And again, if I hide the vertebrae here, spinal cord ends. Here we see the conus medullaris at L2. There you see the ligamentum flavum that's elastic. And again, part of the reason why is preservation of gait and function. So just a few final points. One is that we'll look at the interspinous ligaments and the supraspinous ligaments. The interspinous ligaments consist of 3 different areas, having more elastin in the middle, according to Bogduck, fat pad in the center, and then more fibrous tissue as it connects to the supraspinous ligament that also has a superior layer that's fibrous tissue, a middle layer that appears to connect more with the thoracolumbar fascia, and then the deep part, which is more tendinous, which would make sense if you see where the multifidus is attaching in relation to this. So the interspinous ligament can be disorganized. It sometimes doesn't have those bands that we learned about, but according to Bogduck, it can be disorganized. Not sure if it's really much of a stabilizer for anterior-posterior translation or resisting separation. It's thought more as a maybe, possibly, a proprioceptor, or just an interface that's happening because you have more elastic here and more fibrous components of your collagen here. Lastly, when we're looking at what we're going to do in level 1 in assessing, we're going to take a look at compression and distraction and the forces and how the lumbar spine absorbs these through the discs and through the vertebral body. We're going to do a torsion test, which is going to cause compression of one side of the facets and distraction on the other side of the facets. And then we're going to do PA pressures, realizing that there's different orientations along the lines of the facets, and we're trying to think of these structures that lie underneath when we do PA pressures, when we do torsion, and when we do compression. So thank you for reviewing this anatomy. I'm looking forward to going over it in class and showing you some palpation as well, and we'll see you then.